Good evening, everybody. Hi, my name is Rosie Mota. I'm the Vice Chair of the Health and Education Committee for CB7. This will be my second year on this committee, and we appreciate to see all of you here. And we have our chair, if y'all haven't met him, his name is Jonathan Martinez. He's joining us remotely today, but he will be here for the next time, and we're gonna go ahead and call roll. Let's see if we can make quorum. Oh, yeah. Hello? Hello?
Hello? Okay. Hi, good evening, everyone. I'm going to be calling roll call. Those that are on Zoom, once I call your name, please unmute yourself, say present, and mute yourself once again. Thank you. Julio Peña III, Jonathan Martinez.
Present.
Thank you. You don't count towards quorum. Rosie Mota.
Present.
Thank you. Sylvia Costa. Grisel Amador. Thank you. Damian Andrada. Jalia Bailey. Joan Body. Thank you. Esteban Chavez. Thank you. Maria Cruz. Thank you. Jamie Freed. Nicole Huang. Cynthia Jeffers.
Present.
Thank you. You don't count towards quorum. Susan Parker. Thank you. You don't count towards quorum. Joanna Romero. Pat Ruiz.
Here.
Thank you. You don't count towards quorum. Kalina Surma. Thank you. And Michael Tom. Thank you.
All right, we're gonna count. Oh, no, he just walked in. Yay. Oh.
Okay. Your name? Jamie? Yes.
All right, thank you, Jamie. Jamie the hero.
Okay, so we have quorum.
Great way to kick off this first meeting of the season. Pat yourselves on the back. Congratulations. Yay. Thank you. And so Jonathan will be joining us remotely, but first we want to begin. I hope everyone got an agenda. They're out in front. And we want to begin by welcoming our new members, but do want to share deep appreciation for our current members of the Health Committee. And we hope that this year is even more robust and more engaging for you all. But go ahead, Jonathan, do you want to greet the new members?
Thank you, Rosie. First of all, I just want to thank Rosie for being there for the committee meeting today. And I want to welcome everyone to our committee. And I will be talking more at the end of the presentations about the upcoming projects and proposals. And I would like to hear more about you, your ideas as well. And thanks so much for being there.
All right, so who is a new committee member? All right, who would like to go first, introducing yourselves? Like, what's your name? Any fun fact you want to share about yourself? Where are you from? Who'd like to go first? And also for these meetings and also for the general board meetings, you do have to use a microphone. That way people on Zoom can hear you and anyone that is using a hearing impaired device can hear you. So who would like to go first? Or I can go first. we want. Well, I'm Rosie Mota. And I work at the Latino Commission on AIDS. So I am specialized in HIV treatment and prevention and advocacy and policy. And I'm also learning a lot more about education. I do want to make a plug for the Community Education Council, who was actually having a meeting today. We're part of the Board of Education's District 15, and that is also another avenue for parents, especially, but also community members who want to have a say or an input on how the education system is going on in New York City. And this is my third year on the board in general. And who would like to go next?
What about, okay, now that works. Good evening.
Thank you.
Good evening, everyone. My name is Susan Parker. I work for the City University of New York during the daytime outside my activities here within the community. I am a lifelong learner. I have been in charge of several education projects related to online learning and distance learning for over 20 years. I am a mother of 3 adult children. I am a grandmother of 3 infant and toddlers. And I am new to Brooklyn. I have been in Brooklyn for about 2 years now.
Welcome. So flip it or like keep turning.
Now I just have to look like Freddie Mercury. I'm Maria Cruz. I was an educator. I was a teacher in Brooklyn in District 15 for many years, and then I worked at the university level. And now I am an author of professional development and presenter of professional development for teachers, and a parent of 2 kids who went through District 15, and 1 current District 15 kid and 1 District 2 now high school student. So parent educator.
Welcome.
Hi, everyone. I'm Michael Tom. I'm a psychiatrist. So I work part-time in a community mental health center, and then I'm also opening a private practice. So glad to be here and meet you all and work together.
Welcome. Thank you. And Jonathan, do you want to give an intro for yourself for the new members?
Sure, thank you. My name is Jonathan. I live in Sunset Park for about, I'll say 15 years already. And I really love the community, and that's one of the reasons I'm in the committee. And just want to welcome everyone again. And I hear like someone that is education, a teacher. I definitely would like to talk to you more about our program and where can we take this in that area, the education area. But other than that, I get back to you, Rosie. Continue.
Thank you so much. Anyone else? Miss anybody? Okay. Well, thank y'all for joining, and we do hope that you love this committee, and then you tell all your friends to join the community board and join this committee. We can be really big. This is a big area, and we can use all the help we can get. As many voices we can gather, the more resources we can help bring. Okay, before we move on, just make sure you do check out an email I believe Jonathan sent to everyone. Don't forget to complete the survey by September 12th to see what you would like to be incorporated into the committee. And now, without further ado, I'd like to welcome Dr. Larry McReynolds. He is the Executive Director of the Family Health Center at New York University's Langone and a Clinical Associate Professor at the Department of Population Health at NYU Grossman School of Medicine. And he's going to talk to us about the Family Health Centers. Welcome.
Thank you. Thank you all for having me here, and I haven't been here for quite a while. Can you hear me now? Okay. Hello, thank you very much, Madam Chair, for having me and for the committee members. My name's Larry McReynolds. I'm the Executive Director of the Family Health Centers at NYU Langone, and I'm here to talk about some very exciting news that we have. We have a brand new building that we're building to expand services for the community. It will be a state-of-the-art building that's a relocation of our Park Ridge Family Health Center and of our dental services that are at the main site or within the hospital, for those of you that know the hospital. This co-location will also include an expansion of services, so it will be the existing services plus more dental chairs, more exam rooms, women's services, rehabilitation services, and it's on the former parking lot across the street from OLPH next to our Family Support Center. And this co-location of services will work really great because our idea of health is to take care of the whole person, to ascertain what are your needs. Do you need help with job training and development? Do you need help getting housing, food assistance, domestic violence? So addressing all the needs of the family, all the needs of the person, we'll be able to do it right on that one site. And of course, as a family health center, we serve everyone regardless of their ability to pay. We have a very generous sliding fee scale. And cultural competence, of course, is utmost. Most of our staff speak more than one language, and the same thing for our providers. So in addition to those benefits, the new site will also have parking. Now, I expected some applause or something, but okay, laughter. You know how hard it is to get parking, let alone a new building that'll serve everybody regardless of ability to pay, but we are thrilled that we're able to do it. The construction is already underway. We partnered with a developer who owns the building currently. When it's finished being constructed, we will purchase it from them. And in accordance with New York State Department of Health regulations, we're providing information to you about this project publicly so that we can give you an opportunity to ask questions about it. So at this time, I would love to open it up for any questions that you may have. Yes, ma'am. I'm great, thank you. I can repeat your question.
Good evening. You mentioned rehab. Is that intended for patients who have substance use disorder or different type of rehab?
So this rehab that I'm talking about is physical rehabilitation, outpatient, occupational, and physical therapy. We also do speech therapy. We also do rehab at our 49th Street location. And we're also expanding those services that you'll hear about at a future meeting. We're expanding those services at the former Augustana campus. So we are very excited to be able to do behavioral health services, drug addiction services. So we can connect patients at any of our sites to any of those services, even if they're not physically in that building. And then we also do virtual rehabilitation services for folks that need behavioral health services. Thank you for the question.
Actually, there's someone on Zoom. Pat Ruiz, you can unmute yourself now.
Larry McReynolds, it's been a very, very long time. It's good to see you.
Good to see you, hear you, Pat.
Thank you. Sounds wonderful. I know all the work that the Family Health Center has done over the years, and especially during my time there. And when do you break ground? How long is construction? And when will be the opening?
Sure. So the ground is already broken and it's currently being constructed. So the shell of the building actually has been completed And now we're working on the interior of the building. So it'll take about another year and 4 months. So we plan to open in the first quarter of 2027. The building should be fully constructed in the fourth quarter of 26. But, you know, it takes a while to get the state to come and inspect and all of that stuff. So we expect that it will be first quarter of 2027. All of the staff at each of those sites that I mentioned, the Park Ridge site and the main dental clinic, all of that staff will be transferred and relocating to this new building. We will be educating and informing the patients, you know, a couple months before the building's opening that their records and their staff and their care team is going to be moving. If a patient were to say, well, that's not convenient for me for some reason, we would offer them our other sites or other providers. But thank you so much for that question, Pat. All of the staff are moving. All of the staff are excited because you know the facilities we're in, they're very old facilities. And this will be brand new. Everything will be brand new. So we're very excited to be able to give first-class service to our patients. Oh, thank you.
Can't hear.
I'm sorry, the another microphone was not working. Thank you. United Senior Center has excellent relation with New York Langone and before with Lutheran Medical Center. I would like to ask you, what's going to happen with the clinic in 4th Avenue and 63rd Street?
The current Park Ridge site?
That one.
So we rent that facility from, you know, a private person. And the private person that we rented it from got elderly, left it to their sons. And the sons really are more interested in not being a landlord. And it's not up to me, but the intentions that I've heard is that they want to sell it and develop it into apartments. But I don't know. That's you know. So for us to be able to move into this new building, it gives us a secure future because we will own this building. We will not be renting it. And that is huge, you know, to be a community-based nonprofit that owns their own facility is huge. And so we're so thrilled that we're, you know, able to get out of something that we're paying high rent and high taxes and be able to move into something that is new and wonderful. Thank you for the question. Hi, Sarah.
To go really quick back to Zoom, we'll ping pong from live to online. Jonathan, you had a question, and then we'll go right to you.
Yes, thank you, Larry, for being in the here today. I really think it was important information for the community. My question is more about services. Are we losing any services in this transition, or are we gaining any services in the transition?
Thank you for asking. You're gaining. Everything that exists at the two sites that are getting relocated will continue to exist, and all of those sites will be expanded. So there will be a net of 29 dental chairs. In our current facility, there's 19, so that's 10 more dental chairs. And as you all know, we do a complete array of dental services, pediatric dental specialties, all the way through operations, all the adult medical or all the adult dental specialties. All of those will be relocated, as well as an expansion of general dentistry. Rehabilitative services are a new service for this site. And then the other services, pediatrics and women's health and internal medicine, will be an expansion of what is currently in existence at the other two sites. And so All of the staff will keep their jobs, and we will be hiring new staff in addition to the existing staff. So it's, it's a relocation and an expansion.
Go ahead. Oh, but sorry, use the microphone up here.
Sorry, so I know you mentioned both sites, Larry. You said Park Ridge, and which is the other site?
The main dental clinic in the hospital,
At the hospital.
inside the hospital, right?
All right, thank you.
Sure.
And back to Pat.
Larry,
Pat,
you
you can unmute yourself. Yes.
Yeah, thank you. Larry, you mentioned potential new hires, and I know that in the past, you Lutheran Family Health Centers, NYU, would hire within the community. Is that going to be the case with this or not? I know that NYU is large, but will the FHC continue to support local possible employees?
Sure, Pat, thanks for the question. Yes, so this is a family health center run building, owned building, and we will hire the staff. And for those of you, and many in this room actually, have at one time or another been a patient or worked with the health center, our experience has always been that people from the community are the best staff. They can relate and understand the needs of the patients. They speak the languages and understand the culture of the community. Our goal is always to hire from the community. If we can't find what we need in the community, then we'll look elsewhere, but our priority is always to hire from the community.
Thank you for that. Thank you.
Then yeah, go ahead, Susan. And then we'll go to Jonathan.
Thank you very much for your presentation. It was really enjoyable. My question is sort of twofold. I believe Pat had asked about the hiring practices, but I also am aware there's a partnership agreement with one of the city universities that has a community service worker training program.
Mhm.
That is a part of the Family Center. Is that something that is going to expand and offer more opportunity for students and those looking to transition into a healthcare profession?
So we do have a partnership with many schools, and that is a great source of potential employment for many people. And what I would say is that that's been great for us. That's not part of the plan that I have to give the state or the community. So I'm not going to say that there's something in writing that because of this expanded building that that the jobs or the training will come through that program. But that makes the most sense. We want to continue to build upon what works, and that program that you described works. And so we look forward to, continuing to grow jobs from community in partnership with local institutions. So sure. Mm-hmm.
Jonathan? You can.
Yeah, so I see in the room that there is a lack of understanding of like the broad services that the Family Health Center offers. I myself, as an NYU employee, I'm aware of multiple services, and I feel like the community should know more about the services, and I would like to extend an invitation, either you or someone else in the Family Health Center to come and present to the community in order to better understand what is available for the community.
Sure, we would love to come to any forum and explain our services. We do lots of community-based events with lots of our partners. Some are in this room. And we're always about outreach, education, and engagement, whether you're a patient, a potential patient, or a community member just looking to learn more. So we would welcome that. And we also, as the building gets closer to completion, we'll be having open houses and tours and further events to try to engage community and community partners.
Thanks so much, and I will take that. Thank you.
Yeah, we can do a health committee tour.
That would be fantastic. And if you let me know what kind of folks you would potentially need on the committee, we can get the word out, throughout the health center and look for folks that would be interested in serving. I see already a few. Great.
And we do have a newsletter, the CB7 ticker, the ticker,
Great.
where things like that can be shared on the newsletter. I know Jonathan is gonna speak more on how we can be more more promotional, more vocal about things that are happening using the newsletter. Anyone else have a question for Dr. McReynolds? I only have one question. Uh, will part of the expanded services include maybe more, how do I want to say it, youth or youth health, youth outreach, youth health?
So we do a lot of our youth programs through the school-based health centers. So we're currently in 63 public schools throughout New York City, most of them in Brooklyn. We've we found that that's the best way for us to reach youth, because it's, they're already in the setting, they're comfortable coming after school. So we try to do most of our youth services through the schools. We do have other youth services at our 14th Street site and in the Family Support Center. The building that I'm talking about is mostly a clinic service building. And so we will have adolescent health services there. And so, I'm going to say yes, but more of that outreach engagement is going to happen through our school-based programs because we've seen that work.
Okay, thank you. All right, if there are no other questions, thank you so much for presenting and letting us know about this building. And we really, please let us know how we can support you all in that process, whether in getting the word out or cutting the ribbon. I volunteer. No, just-
Wonderful. Well,
We can all
would
do it
love
together.
to have you all here. And I'm going to take you up on your offer to be of assistance. One of the largest challenges for any health institution, particularly one that serves a community like this, is all of the changes that are going on in Washington. The Medicaid work requirements, if you look at the composition of who's on Medicaid in this community and what Washington is trying to do with work requirements, that will make it so difficult for people in this community to retain Medicaid. And if people don't have Medicaid, then they won't come for care. And we have got to get the word out about how dangerous that will be for communities like this. And if it goes through, we've got to get the word out on how can people retain and re-enroll for Medicaid. That is something that, we need all of you to do. For years, we fought to try to get Medicaid to cover different kinds of health conditions. We finally got that. Now it's being taken away, and we're going back 45 years in time. We have to retain Medicaid coverage.
For that call of action, that is something that we definitely are aware of, Jonathan and I, as we both work in policy. But it is true, as community members, we need to keep on top of what is happening on the federal level. I know this is a very local system, organization we have here, but all politics are local, and it's up to us to remind our neighbors, hey, have you re-enrolled in your Medicaid? Because Medicaid rules are going to change, and we're going to experience significant budget cuts in 2026, especially in April. So it is important for us to keep talking to our elected officials about how this could impact us here in Sunset Park and what they can do in the state to help mitigate any changes in Medicaid coverage. But yeah, thank you for bringing that up.
Thank you.
Who was first? I don't know. Go ahead, Pat, and then
Pat.
Jonathan.
Pat is first.
Larry, is there, do you have a fact sheet that you can share on what's going on with Medicare that CB7 could post on their website and distribute to our email distribution, our MailChimp, whatever we have to get the word out? And if you do, is it possible that it comes in a variety of languages?
So I will work with Sarah and Jonathan to get you that kind of information, and we'll get something back to you. We have got to educate people.
Absolutely.
They do not understand that this is going to take away one of their most important benefits, and it's too late to learn after you've lost it.
Can we invite you to come back and do a presentation to the community?
Sure, or I'll get somebody, even more qualified than myself. But yeah, we'll definitely work together on getting information and getting speakers to help.
All right, Jonathan and I guess Maria can follow up with Jeremy to get this scheduled as soon as possible. I appreciate it.
Yeah, thank you so much. But we will definitely try to keep this committee as informed as possible as changes come. And one thing community members do need to know, that Medicaid is called very, very many different things. Here it's called either Health First or Metro Plus. People say, oh, I have Metro Plus, not knowing that that's Medicaid. It is Medicaid. Same thing in California, they have CalCare. People don't realize that the name of their insurance is actually from Medicaid. So please remind your neighbors that, oh, you actually have Medicaid. So it's important for you to keep up with re-enrolling, because they're going to be very strict or enforce just getting people off by administrative errors because they forget to sign up again. All right,
Thank
so
you.
much. Oh, Jonathan, go ahead.
Yeah, no, I was pretty much gonna about to say the same thing. We will offer this platform as a way of communication to the community. The newsletter also has a really great outreach to the community, so that's also something we can use because it's going to be a lot of changes coming for the 2026, and I will take your word on bringing speakers to the committee to better inform the public and the community, and I'll definitely will be in touch with you to arrange some of these meetings. And thank you so much for coming.
Thank you.
Thank you. All right, we're going to keep going. Oh, I did want to say for our new members, I don't know if this is your first time in here, but the men's bathroom is right behind us. The women's bathroom is right outside. And there's a water cooler back there, or at least there was. So just to let y'all know the layout. And now we would like to welcome NARS, which is the New York Art Residency and Studios Foundation. It's a 501c3 nonprofit. And we have, them three are the representatives, and they're going to give us a presentation.
Hello. Wonderful. Is there a way I can see the slides that are up? Oh, okay. Amazing. Yeah. My name is Carly Terrison. I'm the program manager at NARS, which stands for New York Art Residency and Studio Foundation. You can move to the next slide.
We're not able to see any slides at the moment.
It's being shared now. We're just pulling it up. Can you repeat your name again one more time?
Sure, Carly Terrison, Program Manager at NARS.
All right, we're ready.
So NARS stands for New York Art Residency and Studios Foundation. We're a nonprofit arts organization supporting artists and curators on an international level while also engaging the local community here in Sunset Park, Brooklyn, and the greater New York area. Can we go to the next slide? Oh, sure. So today we're just going to be covering more information about who we are at NARS, our programs. We'll talking more about Sunset Park Wide Open and what we hope to do in our next steps within Sunset Park Wide Open. Like I said, NARS is an arts nonprofit. Our core programs are the International Artist Residency Program, which welcomes over 50 artists annually from across the world and US-based artists as well. We also do exhibitions programming. You can go to the next slide. Oh, before I get to our programs, I'm going to talk about our history. NARS was founded in 2026 by Brooklyn-based artist Juno Lee in response to the need for affordable long-term artist studio space in Sunset Park. NARS became a nonprofit in 2009, and we provide an array of creative support services and professional development opportunities, serving artists, curators, and the creative community in Sunset Park and across New York and the globe. At NARS, we really value cross-cultural dialogue and global understanding. Our programs at NARS include our international residency program. We also have our exhibitions program, which brings in different artists and curators to exhibit their work in our main gallery and project space. We have an array of different public programs as well that includes screenings, artist talks, professional development workshops. We have outreach programs where we've partnered with local schools and the Sunset Park Public Library to give the community here free access to contemporary art programs. And then we have a biannual open studio event. One happens in the spring and one in the fall, which is upcoming in October 17th to the 19th. A lot of this presentation is visuals as we are creative. So here are some photos of different aspects of our international residency program. You can go to the next one. Within our residency program, we have an array of different events and components. One of which is a day of public programs that is organized by our curatorial fellow who works closely with the artists in residence to develop their exhibition. And they also have a day of public programs. We have studio visitors, so different arts professionals across New York City come to meet with the artists in their studios. And the artists gain invaluable feedback and different perspectives from their visitors. We do salons, that includes an artist salon, studio visitor salon, where the artists in residence are able to interact with the artists in our exhibition program, as well as other studio visitors. And then we have ASAP, which is our community building program. So every week, the artists meet and discuss a topic that's relevant to their art practice or in the world. We can continue. Here's some more images of our programs. You can go to the next slide. Our exhibition program presents compelling and innovative work being produced on a local, national, and international level by emerging and mid-career artists and curators. The NARS Foundation hosts 12 exhibitions a year in our project space and main gallery, including 4 residency program group exhibitions. So every residency period, they have a group exhibition at the end of their residency. Here's some more images of different exhibitions from our galleries. Our public programs, which is a part of a program called Art and Dialogue, is a series of different public programs that are free and open to the public, designed to explore and celebrate the dynamic relationship between art and community. And that includes artist talks, performances, screenings. NARS, in addition to all of those programs, also has our educational outreach initiatives. That includes the animation workshop and the Saturday Free Family Workshop. Both are about to kick off a new semester at the Sunset Park Public Library. The animation workshop is a free workshop that invites children 5 to 13 from the Sunset Park community and beyond to actively engage with our teaching artists to build a story through art and technology by creating their own animation. And this promotes critical thinking, curiosity, creative problem solving, and an opportunity to tell their unique story. Our Saturday Free Family Workshop provides greater accessibility to contemporary arts programs and engages entire families in different themed workshops that span across different art practices, so they use different mediums. And then we have our open studios. So NARS Foundation Studios opens up to the public twice a year, once in the spring, once in the fall, offering visitors an opportunity to engage directly with resident artists and their creative processes. Each fall, NARS also takes part in Sunset Park Open Studios, a neighborhood-wide event organized by the community arts organization Sunset Park Wide Open. Some more images from past open studio events. So I'm going to be talking more about Sunset Park Wide Open and our upcoming Sunset Park Open Studios. You can go to the next, thank you. Sunset Park Open Studios was founded in 2019 by NARS Foundation and a coalition of local arts organizations as a grassroots initiative to provide public access to studios and creative spaces of Sunset Park. What began as a neighborhood-driven celebration has grown into a beloved annual tradition showcasing the vibrant cultural life of the area. In 2023, Sunset Park Wide Open was established to carry forward and expand this work. Sunset Park Wide Open is a nonprofit dedicated to supporting the neighborhood's artists and cultural workers. So Sunset Park Wide Open, as we know, facilitates this event, Sunset Park Open Studios. Last year, we had over 180 artists, 9 exhibitions, and 7 partnering organizations. This map here is an example of the map that you'll receive at the event that will outline all the different participating places throughout the neighborhood. And this year, we're really excited about our upcoming open studios during the weekend of October 17th to October 19th. You can see we have different partnering organizations and participating artists and nonprofits. This includes Art Cake, Art Build, Makerspace, J&M Studios, NARS Foundation, as well as the Well Building Collective, Chashama, the Center for Family Life. And in addition to that, we have 60 plus individual artists opening up their studios for the event. This year, we're particularly excited about our collaboration with the Brooklyn Public Library, as well as the City Council office. Will be hosting an exhibition in their office space during the weekend. And the event actually also participates in Open House New York weekend. Here's some more images from past events. And so next steps, NARS and Sunset Park Wide Open are we're focused on growing our audience and bridging the gap between what we do at NARS and at Sunset Park Wide Open with the local community here in Sunset Park. And so we're interested in collaborating with partnering organizations and local businesses to showcase more artwork and exhibitions to reach a broader and more diverse public, making art more accessible to the community here. We have at the table at the front some pamphlets from NARS, and that also includes a background about NARS and Sunset Park Wide Open. And then we also have our current exhibition pamphlets there, and we would love if you came by to see the exhibitions as well. And on the pamphlets at the table, they also have our contact information. If you had any questions or wanted to get in touch about any potential collaboration. Thank you all so much.
Thank you.
Okay. Yes, so like I said, our outreach programs, which includes the animation workshop and the family workshop, is about to start at Sunset Park. The family workshop runs once a month, every Saturday. It's usually like the 3rd Saturday of the month, and that's for 2 hours. And then our animation workshop that's about to start is going to be from September to November, and that's every Monday afternoon. These schedules can also be found on our website.
Share your website with us.
Yeah, it's narsfoundation.org.
All right, thank you very much. Now open for questions. Anyone on Zoom? Oh, Jonathan, go ahead, Jonathan.
Yeah, so I want to know more about the resident program. So let's say someone in the community wants to apply for it. Can you walk me through the process and what that looks like?
Yeah, thanks for that question. We're actually in our open call right now. So um, there's a different application process for international artists versus US-based artists, but our current open call will end on September 22nd. So I would definitely encourage anyone in the community that you may feel like would want to apply before September 22nd.
You say September 22nd?
Yes.
Right. So I'll definitely would like to get that information. In do you have a flyer for that? Are you promoting with a flyer or
Um,
anything?
yeah, it's actually, if you go on our website, it'll be one of the first things that pops up, and you'll be able to access the link to our application.
Great, thanks so much.
Of course, thank you.
And only for us to, um, uh, well, let us know your location.
Yeah, we are 201 46th Street, fourth floor.
And also I would like to extend that we can help support in any way to help promote any community programming. Like Jonathan mentioned, sharing of the open call. The ticker did go out recently, I think, but we'll see if we can get it on the next one before the due date. And I know it won't give artists that much time, but we'll try our best. And
So for our US-based applicants, we have a biannual open call. So the next open call will be later this spring. So in the spring of 2026.
okay, thank you so much for those. Anyone else have a question? All right, thank you very much, Nars.
So, and we hope to see you at Open Studios in October 17th to the 19th. Thank
Thank you
you.
very much.
Thank you so much for coming and presenting.
Yeah, thank you. And we hope to see you back next year. Show us the pictures of what you got this year. And now to move on to our next item is planning for the new cycle. How exciting. I know we're almost there. Hang in there. But I'll let Jonathan give an overview of what this segment is about.
Thanks so much, Rosie. And again, welcome everyone. I'll start with a reminder that the survey that I sent to every committee member will be the due date is September 12th. I just want to emphasize that because I want to make sure that I accommodate as many people as possible in terms of meetings and planning and anything else that we're planning to do in this cycle. Also, one of the goals for this cycle is a planning for a website. I know that a lot of the service, the sections in the website are not updated, so it's something that I'm planning to work on. So something that I've been brainstorming, which is just brainstorming at the moment. I'm open for ideas and any support as well. So, for example, like the names of the committee members are not available in the website, so that's something that I would like to make sure that every single member that is donating their time is recognized as well, so publicly. So I definitely want to put that on the website. A little bit more about yourself. You can do a little profile or anything like that. That's optional. Also, in terms of presentations like the ones that we had today from NARS and the family health centers, I'm planning to have that also in the website for anyone that wants to access those presentations and information in general. Developing a social service uh, section as well, in which like any information on the district will be available there, like social services and things like that. I know that these meetings are recorded, so I would like to also put those records in the website, so for anyone to just go and access anytime. And I would like to also include a data dashboard. So our committee, at least from my perspective, I like to use data, and I like to make sure that we address the issues shown by data. So that's something that I emphasize at the beginning of the last cycle, and I like to emphasize this cycle as well. Like for example, like diabetes rates in the community, um, vaccination rates, or any other health education and social services data that will be helpful to anyone in the community. I plan to make that available in the website. So I will talk more about the social services newsletter, but I'll stop here and can take some questions, suggestions, and anything related to this.
Sarah, then Pat. I mean, Susanna, then Pat. Excuse me.
I would just like to offer up my time to the working group. And Jonathan, most of the stuff that you have listed on tonight's agenda, I could probably assist with.
I'll definitely will take your help and your support.
Thank you for offering that. Go ahead, Pat.
Jonathan, are you, and it's a couple of things. Are you talking about a separate website from CB7 or a link as part as, okay, second question, second comment. In reference to community resources, I actually had a text conversation with Julio because there is an existing community-based organizations list that Jeremy is working on. And I am waiting to see what that looks like. I've been waiting for that for actually quite a number of years. And I will certainly make sure that once Jeremy gets that to me, I will take a look at it and then, of course, share it back with you and Cynthia Felix, who was very interested in that CBO list. I think that was it. Because I don't think you should recreate the wheel, but maybe add to what we already have. Okay?
Thank you. So just for because I just was nodding my head, but just to make it public, yeah. So the link, it will be a link to the website. Yeah, that will be pretty much the idea of this. And in terms of the existing or create the existing list that is being created at the moment, if Jeremy, I'll get in touch with Jeremy with that, but we can assist on that as well. You know, that's the whole idea of creating this list, make it available to the community and to anyone that would like to have that list.
Right, because I can tell you that currently the list has always had the district community-based organizations. It should have any and all presenters like this evening, their information, their websites, etc. It should also have our elected officials from the district, not just our local 38th district, everyone that covers District 7. So that's pretty much it. And I don't have a problem being a part of editing it with you guys since I've been trying to get this completed for quite a number of years. So you can count on me for that because I will continue to be persistent in making sure that we get that done.
We will make sure it gets done.
Oh, trust me, they know me. And I know that Maria will nod her head and say, Pat is a pain in the ass. And she keeps asking for this, and it is the truth. And I will not stop until it gets done because I love the fact that everyone that's new on this committee is willing to step up and come up with these ideas. But unfortunately, sometimes these things fall through the cracks. And I don't know if most of you don't know, I have been on this board for a very, very, very long time. But thank you.
This is a priority for this cycle, so we definitely want to work on this. So I'm happy to take your word on that, and I definitely will reach out to you. And also, I'll send all this information that I'm sharing right now. I will send it through email, so you have that information as well. And I'm inviting anyone else besides Pat. If you want to join and help, because we definitely need a lot of help. It's going to be a lot of work to do this, and everyone is welcome to work with us.
Oh, go ahead.
And if there's any other questions? Yeah.
Yeah.
Hi, if I can help, this is Kalina. I'm happy to help where I can. I think if we can also have a report of how much traffic the website is getting, that would be important, because my biggest concern is just literacy and how much the community is actually going to engage with it. But I think it's an excellent idea for maybe the younger population. And for ideas, if there's a way for us to maybe work with, I'm not too familiar with the Sunset Park area. I'm from Windsor Terrace, but I'm trying to learn more and more and more. And I keep hearing about Mixteca. So
Mhm.
I don't know if there's a way for us to collaborate with those types of organizations and come up with champions who speak Arabic, Cantonese, Mandarin, Spanish, for physical outreach as well.
Kalima, the website is currently being worked on with Jeremy and Julio. So hopefully it'll be up and running. I haven't heard anything any update on it, but I do know that Julio and Jeremy were working on this over the summer. So
And Mixteca is in the list as well of I will be inviting Mixteca to come and present services to our community and committee. So that definitely, thanks so much for that suggestion. And in terms of the report of the traffic, I think that will be part of the dashboard. I haven't really got through like all the components of the dashboard, but I think that's a good idea of including the website traffic. Thank you.
All right, thank you all very much for your suggestions. And I know it's the first meeting, so don't don't lose gas. We have to keep coming next month and next month when it gets cold. We have to all be here to support each other and hold each other accountable. But we're all here to help one another, and we are very grateful for everything, all the support we've had from our staff, uh, with me and Jonathan doing this committee for the first time last year. So we're really hoping to build on our relationships and the foundations we've created. And we do have the amazing support of Pat as well. And Cynthia, thank you for all of your leadership throughout this process.
you're welcome.
Thank you
And
very much.
if there is no questions, I'll move forward to the next section, which is the social services newsletter section. But I'm gonna stop and see if anyone else has any questions before I move on.
Seems good. Go ahead.
Okay, so I wasn't able to see the.
No, yeah,
Okay.
go ahead.
Yeah, so the next proposal slash priority for the news cycle is the social service newsletter. So if anyone don't know, we have a newsletter that goes, I think it's twice or once a month. Natasha, can you clarify that?
It's
Kidding.
Maria.
Maria.
Oh, sorry, I'm sorry. It's just
It
so
goes
hard to
out-
see from here.
It goes out once a week, every Thursday.
Oh, once a week, so even better. So the idea of this social services newsletter is to have a dedicated space in that specific newsletter for services and the community, for community-based organizations to promote the services in the community. And that's pretty much the entire idea. What we have to work on is to gather the information, like the district at the district level, the CBOs that are currently working on social services, or any other CBOs that will be interested in promoting the services through the newsletter. That's one component. And the next component is going to be about promoting the newsletter, because we can only be as effective as the outreach that we can project. So the second component will be on creating momentum and also expanding the newsletter, like trying to do like a small campaign in the district to promote the services of the board and specifically the newsletter, and try to get as many as subscribers as possible in order for to this to work. So of course, this will be a partnership with CBOs because we mutually going to be benefiting from it. So that's the idea. Creating the section and also do the outreach to the CBOs and increasing the subscribers of the newsletter. I think that's the main idea, and I'm happy to take any questions.
No questions right now?
Or if anyone is interested
Have
in
one comment. We have one comment. Go ahead.
I just feel that it's information that I need to share. It's not necessarily a question for you specifically. I am on a working group for a monthly newsletter that goes out that is distributed by the Sunset Park Brooklyn Library. And we distribute this newsletter out once a month. We launched in June of this year. And I have been bringing copies of that newsletter here to CB7 and giving them to Natasha. I am in the process, and this is also relevant to the website, the item on the agenda for regarding the website. I am in the process of digitizing copies for us to have here at the community board. And I know that this is specific newsletter to social services, but if they're to the point on the agenda where in terms of support and outreach with network building, I can also include a section in the newsletter that gets distributed by the library.
That will be great. Thanks so much. And also, likewise, we will be more than happy to distribute anything in our channels.
Jonathan,
Yes.
is it possible, and maybe this is a question for Jeremy, to provide a link on our website or on our newsletter to the library's newsletter?
I'm not sure how can we do that, but definitely something to explore. I think that would be an interesting
Yeah,
idea.
I mean, I think on the newsletter, it might be easier because it's just a link to the document, if I'm correct. So that might be a great resource for the library and for us.
I think that's something that we should explore. Yeah, I think that's a good idea.
Oh, go ahead, Jamie. Jamie, right? Yeah, Jamie.
Not on.
Oh, it is. It is. It just came on.
Okay, I'm sort of excited by all these outreach efforts, but I do want to connect with like what we're doing here as a community board, because fundamentally we're an advisory body for elected officials that are appointed by the borough president. And I appreciate this drive to be a sort of public broadcaster, but I wonder about like the utility of having, say, people come to these meetings and broadcast social services to the like couple dozen people who are here. And I wonder if our efforts could potentially be better served, like, weighing in on the bills that are in city council for our city council people, because I do think that the ratio of like presentations and meetings that we have to the number of resolutions that we pass or present to the full board is quite stilted. So I just want to, connect with our sort of purpose as a committee.
Yes, I totally agree with you. I'm all for political engagement, and as you saw in the last cycle, I really push into the political engagement. And I feel like building these platforms is just another way of keeping the same political engagement. There's a way to communicate message through social media, and I feel like a lot of the messaging at 2025 and going forward is mostly going to be a lot of social media engagement. So that's one of the reasons I'm doing this. It's an effort to get engaged with the community, which is our duty as a community board. We're looking for the district. and we're trying to connect all the dots in the district. And in terms of political engagement, I'll definitely, I feel like we should get like a focus on legislation as you suggested. And I'm happy to work with you if you have any specific interest in any legislation coming up, either city or state level, as we did in the last cycle. And that's something that I also planning to do. The reason I'm bringing these two priorities is because we have to develop them this cycle and the upcoming cycle as well. But in terms of presentations and political engagement, that's something that with the committee will still engage on it. But thank you for your suggestion, and I'm happy to work with you, like I said before.
Yeah, thank you very much. We can definitely strike a balance between CBOs and learning about policy. And that's going to become more important now than ever to keep pushing policy and learning how to advocate for ourselves and one another.
And sorry to interrupt you, Rosie, and also especially because of the Medicaid changes that Larry mentioned, it's going to be a lot of political engagement. And I don't know how engaged is the committee at the moment with the new members, but I'm a really political person, so you will hear more about those issues. And anyone in the committee that has a specific issue that would like to advocate for, feel free to reach out to me and I'll definitely put that in the agenda.
Yes, we can all keep our eyes and ears open. We don't know everything or can't know everything. So if you know of something in particular that impacts Sunset Park or the communities that live here, please share. And before we close, I just want to mention a few announcements, and anyone else who has an announcement they'd like to share. The 9/11 memorial is happening in Sunset Park. Sunset Park, especially for those who haven't been here that long, it is a living memorial grove, whereas it's a living garden in Sunset Park, and it's meant to memorialize 9/11. And there's a ceremony or an event happening on 9/11 at 6:30 at the garden. And also, happy first full week of school. I hope your children or your neighbors' children's are having a good week so far and are enjoying their new grades. And I hope they're doing okay without their cell phones. But just remember that your kid does not have their cell phone on them. So think of any other contingency plans you may need to have, especially during this time. And especially if you have any neighbors who are afraid of ICE. I know it's a concern about family separation. So please think about any plans you or your neighbors may need to make, or check in on your neighbors. And on September 20th, the borough president is having a back to school event. It's in East Brooklyn, but in case you know anyone or if you need to go, it's out near Canarsie. There's a back to school block party on September 20th from 9 to 2, where they're gonna have backpack giveaways in case you know of anyone who is still in need of any more school materials. And again, I'd like to plug the CEC, Community Education Council. If you'd like to join them or just check out, see what they're about, especially if you're a parent of a student at New York City Public Schools. Anyone else want to share anything? Go ahead. Oh, but you have to come over here. I know. We'll find a better system at some point. We just started the year. We're working it out.
Want to inform that United Senior Center, thank God, we signed the lease. Thanks to the City Councilor Alexa Viles and to the Assemblywoman Marcela Maitanes, and we get the funds. They helped me to get the funds to keep the Senior Center open. I just want to say thank you to Cynthia Felix and also to David Estrada and to the community because they helped me a lot, getting paint supplies to get what the senior needs in order to keep open and to provide the service to the seniors in the community. Cynthia, Felix, thank you. And David Estrada, the same. So to the people in the community, thank you. Damaris Santiago, thank you. and also to George. Mr. Villa también, Andy Villar también. Thank you. Thank you very much to everybody.
Well,
Congratulations, grand opening.
Congratulations. I'm glad you're sticking around. We need you. Okay, anyone else? Oh, go ahead, Pat.
I'm sorry that this just came to my head. The presentation that Larry McReynolds gave us on this new building, did he say that they were going to want public input? And if yes, do you think that, and the answer is no, do you think that this is a presentation that should also be made to the full board meeting because we have a larger attendance?
Well, he did say that he is mandated by the state to present this plan
So could
for
we,
community input, but he didn't specifically say how to provide input.
so I am going to suggest, Jonathan and Rosie, that we can get Larry to come back and maybe speak to Julio and present this at the full board meeting where there's a wider group of people and residents in attendance that should know this.
I believe that that would be the right move.
I appreciate it. Thank you. And as soon as possible.
I'll definitely coordinate with Julio
Yep.
and we can arrange something. But yeah, that's a really good suggestion.
We have one more question, comment?
But I agree with you that this is a very important information about benefit that will bring to people in the community board 7, and also like for me, because I will pass that information to the members of United Senior Center of Sunset Park. Thank you, Pat. Thank you,
Also,
Jonathan.
we will make sure to send any information to you as well. Like Larry stated that he will be sharing some information, so I'll make sure that the board send you the information as well for the seniors.
Yeah, let's just get him back.
Okay. Anyone else want to share any happenings, ongoings? All right. Well, thank y'all very much. And I know it's early, but early voting is October 25th. Start making your plans. Okay?
Thanks so much, everyone, for
Thank you
showing
very
up.
much.
Good night, everyone.
Thank you. Thank you. See you in October.
See you at the